healthresourcedirectory.org.au. Patient Fact Sheet. Behavioural disorders in children and young people. What is it? A behavioural disorder is when a child has difficulty with their emotions and behaviours. Their behaviour can be negative towards others, not follow expected rules, or they may not do as asked or expected. To be diagnosed, the behaviour has to be severe enough that it is affecting the child's ability to function, such as physically, socially, or academically. Types of behavioural disorders. Oppositional defiant disorder, a pattern of angry or irritable moods with the child arguing and being defiant or vindictive for at least 6 months. Intermittent explosive disorder, repeated behavioural outbursts that are impulsive, out of proportion to the event, and the child finds it hard to control their aggression. Conduct disorder, repeated negative behaviour which is against the expected rules for their age and continues even with consequences in place. Pyromania, fascination and attraction to fires and repeatedly and deliberately lighting fires for their enjoyment. Kleptomania, repeatedly steals because the stealing gives the child a sense of pleasure once they have stolen. What will my GP do now? Your GP may refer your child for treatment. Mild to moderate behavioural disorders in children can be treated effectively with early intervention and child behavioural strategies. A referral does not mean that your child is seriously mentally unwell. Your GP may also refer you to a parenting program to learn new strategies to manage their behaviour. Refer to a specialist service if the behavioural disorder is severe or if your child might need medication. Your GP will want your child to come back so they can check how they are improving. If they are not improving, your GP may discuss other options to assist. What questions should I ask my doctor? There is a lot going through your mind, and it can be easy to forget the questions you want to ask your GP. Here is a list of questions you may want to ask. What can I do to help my child now? What can I do to help my child over time? When should I make another appointment? How quickly can I expect results? What happens if my child gets worse? What can I do? It is important to support your child in learning how to manage their emotions and behaviour. Treatment can often take time. Some of the things that you can do include getting treatment early as it helps prevent the behaviour getting worse. Spend quality time with your child to strengthen the relationship. Try not to get frustrated when your child is being reactive or not behaving like you want them to. It may make the situation worse. Look after yourself. You are the child's main support, and it is easy to forget to maintain good self-care. What supports are available? Public health and other free services. The Infant, Child and Adolescent Mental Health Service, ICA-MHS, provides specialist treatment for children and young people up to 18 years of age. Talk to your GP about this service. The Primary and Community Health Psychology Service provides free psychological assessment and treatment for children up to 12 years. Contact them on 8788 4200 and ask to speak to the psychology intake worker. The South Western Sydney Youth Health Service provides free counselling to youth aged 12 to 21 years. Contact one of their centres and ask to speak to their intake worker. The Corner Youth Health Service in Bankstown on 9726 8633. The Fairfield Liverpool Youth Health Team on 8717 1717. Trackside in Campbelltown 4625 2525. Headspace provides bulk billed counselling services for young people aged 12 to 25. Contact one of their centres to make an appointment. Bankstown on 9393 9669. Liverpool on 8785 3200. Macarthur on 4627 9089. Southwestern Sydney PHN Mental Health Services provide 2 services to improve access to mental health service for children and young people. Staff for Kids is for children aged 3 to 12 years, and You in Mind is for young people over the age of 12 years. Both services include criteria to be met and a GP referral. Speak to your GP about this service and whether a referral would be beneficial. Private options. There are many private specialist and allied health providers that can treat child anxiety. Speak to your GP about rebates for treatment. This information is to be viewed by someone who has received a diagnosis from their doctor. It is not designed to be used to diagnose a condition or as a substitute for ongoing medical care. Health Resource Directory fact sheets are endorsed by Southwestern Sydney PHN's Community Advisory Committee and local GPs.